According to the New York Times, March 18th, 2021, there have been over 29.6 million COVID cases in the United States and over 530,000 deaths. Learning about the impacts of COVID and how to prevent this disease from spreading is essential to our generation because we have no clue how long this virus is going to impact us. My name is Alexandra Rogers, and today I will be discussing with you the impacts of COVID, how other regions have battled this virus, and how the United States should adopt a new policy. To start, COVID-19 has strongly impacted the United States. This virus has taken the world by storm with the amount of cases. As of September 15th, 2020, there have been more than 6.5 million confirmed COVID cases and more than 195,000 deaths in the United States, says Brookings Education, September 17th, 2020. To put these numbers into context, that is 3 times the amount of the lives claimed in the Vietnam War. While many scientists and researchers have been studying this virus for over a year now, they're finding more about the virus than they are an actual cure. According to WebMD, December 13th, 2020, there are now vaccines out for COVID-19, but there is no cure. Another issue is mask mandates. The United States has tried to invoke mask mandates in public places such as restaurants or shopping centers, but cannot truly be established because that would infringe on a person's constitutional rights. Next, regions other than the United States have been able to find ways to battle COVID. The issue with COVID is that it impacts large groups and people that are close in contact with each other. According to the Centers for Disease and Control and Prevention, October 28, 2020, COVID-19 is thought to spread mainly through close contact from person to person, including between people who are physically near each other within 6 feet. People who are infected but do not show symptoms can also spread this disease. In summary, this virus is affecting people that don't even know they have it and is spreading it to other people. However, New Zealand found a way to combat this problem. It has a 4-level system to take down COVID. It can be applied at different levels, rid the country of thousands of cases of COVID, and was proven an effective method for New Zealand. The island country of 5 million declared the pandemic over in approximately 100 days, says Contagion Live, August 9th, 2020, which is perfect evidence to support why the United States needs to adopt and implement these new policies into the United States. Lastly, the United States should adopt the policy of New Zealand to lower these COVID cases. The system has 4 different levels of specific policy action, and the levels are based on how contained the disease is, according to Wayback Machine, February 7th, 2021. The levels start in preparation mode and gradually increase into reducing, restricting, and eliminating the disease. Many of these policies are the same in the United States, shutting down mass gatherings such as schools or jobs and leaving only the essential jobs up to play. But the difference between their policies and ours is that it's done in categories and rather than all at once. They change based off of the health of New Zealand, and their system is more organized. Therefore, easier for the government to implement onto the people. Therefore, if majority of these policies are already implemented into the United States, it will not be difficult to organize them in a more efficient way to advocate for change in the United States. For New Zealand, the system began at level 2, but around March 25th, it had risen to level 4. That triggered a nationwide lockdown, with only essential services running and people were sent home in their personal bubble. At that point, New Zealand had only recorded 102 cases and no deaths. At around the same time, the United Kingdom locked down, and it had more than 6,500 cases and more than 330 deaths, says BBC News, July 9th, 2020. As we can see, this is what happens when other countries don't use the effective method that New Zealand has already put into place. This statistic itself proves that the system is logical and effective enough to lower the impact of COVID in the United States. Many people believe that this system would not work in the United States because it would infringe upon our constitutional rights, because many believe that the government cannot force anything upon an individual. This notion is incorrect because each policy level coincides with our constitutional rights and can be implemented at a local and national level with no constitutional infringement. Therefore, change is needed in the United States, and it starts with us. Following some of these simple rules already presented by New Zealand's 4-level system, which are also already being implemented in the United States, can truly change the path of this virus. I have just discussed with you how COVID has impacted the United States, what other regions have done to battle COVID, and why the United States should adopt the New Zealand policy. It is important to remember that change can only occur with the start of your actions.